revered Swami Sarvalokanandaji Maharaj, respected Dr. S. Orulraj, who is our President-elect API and was the past President of IMA and the convener, main guiding force of this conference. Our respected Dr. Devashish Bhattacharjee, the Director of Medical Education Service, Department of Health and Family Welfare, Government of West Bengal, who has been number of times associated with our associations and helped us in various ways. Dr. Rajoy Chakraborty, Director of Health Services, Department of Health and Family Welfare, Government of West Bengal, and he has been actively participating in this conference in the scientific session too, in a particular session. Tomorrow there will be a session for him. Dr. Amol Banerjee, our beloved Dean ICP, he was ex-President API and a guiding force behind the entire activities of our organization. Dr. Jyotirmoy Pal, Vice President API, also the main person, I should say, he has got a pivotal role in organizing this function. Dr. Udas Ghosh, very close to our heart, dynamic, organizing scientific secretary of our branch, and always very vigilant in spite of his posting in Murshidabad, always tries to keep contact with us in various programs and activities of our organization, especially the scientific part. Last but not the least, Dr. Shivendu Ghosh, Honorary Secretary of API, and a very, very active person in almost all the activities of this particular conference, and he has been working very hard. Ladies, gentlemen, my dear colleagues and my student friends, this particular conference, that is the 26th annual conference of API, is probably the last conference of our tenure of this particular organizing body, because last year we had our annual conference in Siliguri along with Eastern General Conference, and this time we had in our mind that we should go for the third GCDC simultaneously, just to get a better exposure of our interactions and percolate the idea of thoughts in relation to various newer developments which has taken place in the field of diabetology and cardiology, both of which are the real means for the society. And as you all know, as our age is advancing, the brunt of the whole things falls on the aging population, especially due to these two combinations of these two diseases. And you all know that diabetes is considered to be a synonymous to that of a cardiovascular disease. Besides these things, we have tried to incorporate the other aspects of the internal medicine in such a manner so that there should be a good amount of exposure of the postgraduate students so far as the clinical material as well as the recent advances are concerned, and various dignitaries who have come and faculties who have come outside West Bengal and also from supposed to come tomorrow from some other parts of the country and also from outside the country. I'm sure that all will be benefited by exchange of our thoughts. You all know that this API is basically an academic forum. It's an academic forum. I reiterately, specifically tell, it has got nothing to do with anything else but to spread the knowledge. And this is the reason the ICP wing has come up, which is the sister wing of API, and is trying to spread the message how to develop the recent advances in the remotest corners of the country by exhibiting a lot of conferences and at the same time a lot of small seminars, and also in the real field scenario like holding some camps in the form of blood donation camp, then vaccination camp, ECG, blood sugar monitoring. These are the regular activities we are doing. Monthly clinical meeting is a part of our API activities. In all the medical colleges, we try to hold one clinical meeting, and that is the way we are doing our noble job. We are in presence of our guest of honor, both our DME sir as well as our DHS sir. I have got an humble request. The API people are always there, senior people are there. If you have got anything, sir, we have to extend any sort of help. So far as the academy is concerned, we are ready to expand this thing for the benefit of the state as a whole. We are sure that under your able guidance, our state will definitely get all sorts of help, especially for the postgraduate as well as the undergraduate level. Besides these things, I am very much grateful to Swamiji, who is actually, I had a long association with this Swamiji, because I was also, at the time, I had my post-graduation from Ramakrishna Mission Seva Pratishthan. So he is a person with full of spirituality and wisdom, and because in spite of his busy schedule, he has come over here to spare his some time with us, and I am sure that we all will be benefited. No conference can get his success until and unless there is a good amount of participation from the delegates. So I extend my heartfelt thanks to all the delegates and welcome all of you. In spite of our best efforts, I am sure that there should be some amount of lacunae maybe from our part, but your generous attitudes will definitely forgive us if we have got any lapses. With these few words, I take leave from you. Thank you very much.